Back in 1964, President Lyndon B. Johnson proclaimed February as American Heart Month, urging Americans and Congress to pay attention to the nationwide problem of heart and blood vessel diseases.
And 58 years later, even with all the information we have, cardiovascular disease remains the leading cause of death for women, causing 1 in 3 deaths annually. And joining us again today to discuss women's cardiovascular health is Dr. Stephanie Hack. Dr. Hack, thanks so much for joining us.
Thank you.
Thank you for having me.
So we often think of heart disease as a man's disease, but how serious is heart disease actually for women?
Oh, it's incredibly serious. So as you mentioned, heart disease is the #1 killer of men and women. So when we write it off as just a men's disease, then we are preventing ourselves from actually doing prevention and educating women about it.
And Dr. Hack, how does menopause impact heart disease risks for women?
Sure. Estrogen has a protective effect on our heart and blood vessels and many other parts of our body. So once menopause happens and our estrogen levels decrease, we see a rise in things like cholesterol, a rise in blood pressure, and all of those things increase our risks for cardiovascular disease.
Talk about some of those, overlooked, symptoms of heart attack for women, and how are they overlooked?
Definitely. When we hear heart attack, we automatically think chest pain. But in women, they might not present in that same kind of classic way that men do, and they can be more subtle. So chest pain could be chest pressure or chest tightness. They may also experience back pain, neck pain, or jaw pain. Lightheadedness, shortness of breath, nausea, and vomiting are all ways that a heart attack could present.
Is wheezing also included in one of those as well?
No, but it's possible depending on how your shortness of breath presents and what other medical history you have.
Okay.
And talk a little bit about early warning signs that women should pay attention to, even if she is young.
If you have a strong family history of cardiovascular disease, then you really need to pay attention to symptoms. If you have elevated blood pressure, high blood pressure, and it's just not getting lower, that's something else to pay attention to. And then also if you have a history of other chronic conditions like diabetes, or during pregnancy if you had certain complications like preeclampsia, high blood pressure, gestational diabetes, those are all things that say, okay, I might have an elevated risk. I really need to pay attention.
And Dr. Hack, what are some 3 daily habits that women can do to reduce the risk of heart disease?
Well, we're always going to go with diet and exercise. So a heart-healthy diet, which is whole foods, fruits, vegetables, lean protein, healthy fats is good. The recommended exercise is 150 minutes a week. So, 30 minutes, 5 days out of the week. Those are all very good things. Reducing your stress, getting enough sleep, also very important.
How do pregnancy complications affect a woman's long-term heart health?
So pregnancy is like a big stress test for your body. Your blood volume increases during pregnancy. It puts a lot of stress in your heart. So if you develop something like preeclampsia or high blood pressure or gestational diabetes, those are all things that can increase your risk of cardiovascular disease later on in life. So they're a nice alarm bell that goes off to say pay attention.
What is the typical age in which a woman can go and to the doctor to get this checked out, just to make sure that she is okay and doesn't have to worry about this?
This is something that we should be in conversation about at every annual visit, especially if you have a strong family history of cardiovascular disease.
Gotcha. And can you talk about which doctor you should be going to on a regular basis to be able to get that checked out?
So your heart doctor is a cardiologist, but often people are seeing their primary care provider or their OBGYN. So if you start the conversation, if you have concerns about these symptoms, then your doctor can refer you to a cardiologist as needed.
Is there anything that anything new that has risen up in terms of early warning signs or things that they can do to notice, like, okay, I may be having some issues here or I may not be?
If you notice just feeling incredibly tired or feeling very different, anytime that you have a new symptom that you can't easily explain by something else that happened, that's something that you should bring up to your healthcare provider.
All right. Dr. Hack, thanks so much for joining us.
Thank you.
Thanks for having me.
All right, for more information on women's health and Dr. Hack's podcast, visit ladypartsdoctor.com.